Hello, I'm Lisa Tyler, your host for Senior Connections. This is your monthly look at issues relating to older adults and things that concern them and their caregivers. This program is a service of Senior Resources, which is your local area agency on aging, serving Muskegon, Oceana, and Ottawa County. We're here to try to help navigate what can be a very confusing network of services and programs for older adults, ranging from long-term care options to medication, cost of services, Medicare prescription benefits, and more. And this month, November, is Home Care and Hospice Month, so who better to have on the show than representatives from Harbor Hospice? So we're here to talk about this important topic. My guests today are Lisa McMicheal, who is the President and CEO of Harbor Hospice, and Lori Goudie, who is the Community Engagement Specialist at Harbor Hospice. Welcome, ladies.
Thank you.
Happy to have you today. So both of you are relatively new to Harbor Hospice, haven't been around for years and years. So let's get to know you a little bit. Lisa, we'll start with you. Tell us, how long have you been there and what were you doing before?
Okay. Well, as of yesterday, I've been at Harbor Hospice for 1 year.
Happy anniversary.
Thank you. And I've had a long history working with seniors and probably about 25 years of doing that now, where I've worked in all areas of senior care, from independent living, assisted living, home health, and then I was a nursing home administrator for quite some time, and the last position I was in as executive director was at Marywood Health Center. And that was a great position, and it really, we were primarily a rehab facility, so oftentimes as a nursing home administrator you have rehab and long-term care. Primarily a rehab facility, but we also had a wing that was designated just for the nuns on the campus of Marywood Health Center. So that the Marywood campus is part of the Dominican Sisters. So that is probably where my passion for hospice really grew. Oftentimes people would come to rehab with the hope of having rehab and getting better. And sometimes people found out that that's not where they were and that the rehab wasn't helping. And it, more than any other position I worked in, it seemed like that happened more often there than anywhere. And I became the person to talk to the families about hospice and helping them understand, you know, why rehab wasn't working or where their loved one was at that point. And it just really grew the passion of wanting to educate the public on what hospice really was all about. And then this position came open and decided to come here and see if I could make a difference in this world.
So what was interesting about this position in this community, because this is a new community for you as well?
And I've lived in Grand Rapids my whole life, and when I first heard about Harbor Hospice, it was through a friend of mine that actually lives out here in Muskegon. And she knew the executive director, president, and CEO previous to me, and knew that she was retiring. And we just happened to have dinner. Me and my husband would come out here quite often and have dinner with her and her husband. And she told me about this position. And I kind of went, that sounds really interesting to me, but it's in Muskegon. So really had to think about, you know, did I want to relocate? What do I want to do? And I brought this home, and we agreed that Muskegon was a place we wanted to live. We've always had a desire to be on the lakeshore, so that was appealing, of course. And the other thing that was really appealing, too, is the fact that it's a smaller community. And almost right away coming to Muskegon, even before I moved here, just in the position, I realized how integrated this community is. And it really is a very different feeling from where I've been my whole life. So I very much have enjoyed that and enjoyed getting to know the people here, and there's a lot of connections, and you find that really quickly, that people know people, and that's part of what we do. So that was pretty exciting.
Which is perfect for your work, because you're right. Previous CEO had been there for 30 years, I think, or something like that, and very well known, was kind of interchangeable with Harbor Hospice. And to me, having grown up in a smaller community than this was a bigger city, but it is, you're right, it's very interconnected, which is fabulous with the work we do for older adults. And you're not all older adults, I know, we'll talk about that. But
that's true.
Lori, how about you? How long have you been with Harbor Hospice, and where were you before?
I've been with Harbor Hospice about 4 months now, and prior to that, I was in the medical field for about 11 years, close to 11 years. I worked for Mercy Health Partners, Affinity Health Network, which is the physician hospital organization for Mercy. And we did a lot of the service and the contracts on Mercy's behalf with the payers. We also had serviced all the providers in Mercy's network, which included primary care specialists, hospitals, and some of the facilities around the area we serviced. A big part of my role was building relationships with these practices and seeing what we could do for them and seeing what their needs were. And then as that role grew, I was into recruitment and development for providers into our network. So we were trying to grow our network and getting up into areas like my responsibility was Oceana County and Mason County. So we would, or I would, go out and talk to the physicians, tell them the services that we could offer, the services that Mercy could offer them. Part of that was, I did for the first several years, I serviced Harbor Hospice. They were one of my main offices. And so I got to know the team there very well. I got to see a lot of them, what they were looking for, and I could see the passion in every single one of their roles, because I would meet with different people in different departments to see how we could help them and what their needs were as far as from the PHO. And so I could see that there was such a willingness to do whatever it would take for the patient, for the family. So that really kind of set a little soft spot in my heart. And most recently, my father-in-law used Harbor Hospice on his final journey. And personally, I got to see what Harbor Hospice could do from a personal side, and I was in awe. It was just amazing. There's a team approach, anywhere from the doctors to the nurses to the social workers to the grief counseling department and the chaplains. It was just amazing. They were all there as a team, and they all handed off what they needed to do, and everything just ran so smoothly in an area that was very new to me. This is the first time we've had, myself and my husband, it's the first time we've had a family member that was at the end of life. So that was real important to us, to make sure everything was in order and everything went smooth. And they just did an amazing job. And even from the volunteers that came in, my father-in-law had a pinning. It's called the Vet to Vet program. We honor veterans as the program, but it's a vet to vet. It's a peer-to-peer, and it was just so touching, what they did. So I really appreciate that.
So that made you interested in,
and that gave me,
joining the team?
And then at the same time, or a little bit later, there was the opportunity that came up for this position, and I couldn't pass it up. I just said this is where I needed to be, and I'm just very, very grateful that I'm at Harbor Hospice and I'm willing to help in what I do.
Wonderful. Well, that's really great. So a lot of our viewers probably know about hospice in general, but Harbor Hospice, but you don't want to assume that, because hospice it's not like it's been around for 50, 60 years. It's a newer concept. It wasn't something I knew about as a kid, something I've known about because my father was very involved in it in another community. But let's talk a little bit about, Lisa, about the mission and the history of Harbor Hospice.
Well, the mission of Harbor Hospice is to bring empathy, expertise, and excellence to end-of-life caring. So I do feel like we live that mission every day. And people who work for Harbor Hospice I think for hospice in general too, I think is a very unique person who chooses to do this line of work. And the biggest thing is really, we want to be able to provide quality of life at any time for people in their lives. Everybody deserves quality of life, even at the end of life. And we really focus on what their needs are, what their desires are, what is it that they would like to do in their last days. And I think that's just really important in bringing comfort, and it's not just the patient that we bring comfort to, it's the families. We want people to feel comfortable talking to us. We have, as Lori said just a few minutes ago, we have all the different disciplines that are involved, from our physician to the nurses, social workers, chaplains, and our volunteers. And we utilize every single role to help bring comfort and ease the worry for the family. That's our biggest goal.
How long has Harbor Hospice been around in Muskegon?
Harbor Hospice was founded in 1982 and accepted our first patient in 1983.
Oh, wow. So 35 years.
35
Do
years.
you have anything special planned for 35 years?
We do. We're celebrating our 35 years in 2018, and in the spring we're going to have an open house at Harbor Hospice, which is in the Fracano building in downtown on the 4th floor. So we plan to have an open house and a celebration, so just to bring the community in and hopefully just to celebrate what we've done.
Wonderful. How much before that, how early on in hospice did Harbor Hospice come in? Had hospice work been out for quite a while, or was Harbor Hospice, I kind of feel like they were on the leading edge of that.
They certainly were. And that hospice was quite a foreign topic at the time. People didn't understand what hospice was. I think people viewed hospice as, and unfortunately I think they still do view hospice as this is where, it's eminent that somebody's going to pass away, and now we call hospice in. And sometimes people wait really way too long. We've sometimes had people come into our care that are only in our care for less than 24 hours. And hospice has so much more to offer than that. There are many benefits to hospice. Typically, when somebody has been given a poor prognosis of 6 months or less, is certainly a time to call in hospice. And also if somebody, for example, if somebody was getting aggressive treatments for cancer, they're getting chemo or radiation, and they've come to a point where either the treatment's not working anymore or they're tired of it. Those treatments are have a lot of side effects, and it's exhausting for people. It oftentimes makes people weak and tired, and sometimes people just don't want to do that anymore. So to call hospice at that point is very appropriate. We can help, sometimes people come into hospice and they don't need a whole lot of help yet, but managing the medications, and could be as simple as that. It could be a nurse comes to visit once a week, manage your medications, chat with you, find out what's going on. Are your symptoms changing? Is there anything else that we can help with? And I've found, and I've had my own personal experience with this too, that just in that part of it, when they come in and do that, it's just one less thing that you have to worry about. And oftentimes you find caregivers that have been doing things like this for years, managing their loved ones' medications, doing those extra tasks. And when you don't have that to worry about anymore, it really does alleviate stress. And certainly if you know that that's the point that somebody is at the end of their life, it's most important for you to be able to spend time with them. Be able to be there for them, not worrying about managing all the medical aspects of it, but that I can actually, be home with my loved one, go do something fun, live life to the fullest at that point.
So really, and I've heard this for years, there's still too many people who think, oh, if I call in Harbor Hospice, that means that we might only have days left.
Correct.
It really is something they should do once you've been given that 6 months or less prognosis, right? Because
Yes.
because you've got palliative care in there as well, right? So let's talk about that, because that's a newer phrase for people that you're hearing about.
I'm glad you brought that up, because palliative care is a bit different from hospice. Most palliative care services are offered through hospice because the nurses are specially trained and in symptom management, and that's part of what hospice does too. But the difference is with palliative care is once you've received any kind of diagnosis that could be life-threatening, that could be diabetes, could be a heart condition, somebody may have had a stroke and have recovered from that, but there's symptoms to be managed. I like to use diabetes as a good one for that, because people never think of that typically as something that you need extra support with. there are people who are on insulin, or they might be on different medications, there's diet to control, all these different factors. And what's great about palliative care is that we can come in and work alongside the primary care physician. So we don't take over services. We work with the primary care physician that you're already working with, that you already go to see, to provide those extra supports outside of the doctor's office. So and symptom management can range anything from pain, and pain is generally a big topic, but just managing the disease process too. So many times with a diabetic, and working in rehab for many years, I've seen this over and over again. There's a cycle that happens. They don't have resources in the community, or they don't know how to tap into those resources to really manage their disease process. So they'll have, they're not managing the process. They manage for a while, maybe for 6 months, maybe even longer sometimes, particularly with the older adults, the senior population. Oftentimes they don't have support at home. Sometimes they live by themselves. And they end up in the hospital because an emergent thing has happened. And they go to the hospital. They end up being in the hospital for a few days. Oftentimes an older adult will decline because they're susceptible to that. They will come for rehab, get stronger again, get discharged back home, and within a certain amount of time that process starts all over again. So palliative care is a great resource to help manage those symptoms and keep things under control. And there's so many varieties that palliative care can help in. And we actually get quite a few referrals for palliative care because people just aren't be able to manage
Are
these
those
disease
referrals
processes.
coming from their doctors many times?
From the
especially
doctors,
for
from their hospitals, typically.
maybe before discharge or something.
Yep.
So that would be different than, that's not a 6-month prognosis or anything.
No.
Because you could have people getting help for
Years,
Right.
years, yes.
And that's a newer concept, isn't that?
Yeah.
And newer for hospice to do.
It is, and that's people haven't heard the term palliative care very often, and because hospice services provides palliative care, it's hard for people to separate
Because
that.
they think, oh no, I'm getting that, that means I'm going to die, and somebody hasn't told me that, but does not mean that.
No, it does not mean that at all. No, we really want people, again, it's all about quality of life. We want people to be successful living in their homes, out in the community, hopefully prevent those ER visits, which are oftentimes traumatic. I think for anybody, particularly for our older population, but for anybody, and just everything from taking an ambulance ride to getting to the ER, to waiting in the ER, and all the different things that are happening.
Just all the things you're exposed to.
Absolutely.
So being at home as much as you can without the risk of contracting something that unfortunately you can when you're around other sick people.
Right.
It's much healthier all the way around.
It is. It absolutely is.
And you can look at it as like an extra layer of support services that we can offer
Great
the
way to say
patient,
that.
the family, and the family specialist and their PCP. So it's that extra layer of support that really helps.
I think one of the things that's really critical, both with palliative care and the actual hospice services, is that it's more than just helping the patient. It's helping the family,
Yes.
those caregivers, and the loved ones who are doing their very best to try to keep the spirits up and keep them healthy. And as you
Yes.
said, just that little bit of break, another set of hands to come in so that maybe once they set up so the meds are all in. We've got all kinds of ways of taking those, but getting them all set up is complicated for a lot of people.
It truly is. And oftentimes the resources just aren't available, and the family doesn't know who to turn to or how to ask for these things. And people go to the doctor, and you're having pain, and typically you'll get something for that pain, but sometimes there's side effects from that too. Different
Side effects can be worse than the other thing.
Absolutely.
So,
Yeah.
Lori, when you were talking earlier, you mentioned volunteers, and I know that's one of your areas of specialty. Let's talk about that role. So we know we've got you've got your doctor, you've got nurses, you've got social workers. Those are all highly trained individuals and very special people. As you said, I think it's amazing that nurses and doctors are trained to heal people.
Yes.
When you're dealing with hospice, you're trying to make the best of the final days, as you said, in quality of life. But volunteers, that is another really special group of
It
people, because now
is.
you're not even getting paid to
Right.
come in and assist. Tell us what opportunities are there for volunteers?
Volunteers, we have such a special group of passionate volunteers. We have 92 current to date, and they come from different types of lifestyles, different types of experiences. Most of them, almost all of them, have had some personal connection with Harbor Hospice. A lot of them bring special talents. We have non-direct patient care and we have patient care. So you have like two categories of volunteers. So we have something to do for everybody. And our non-direct patient care they'll help us, and they're such a big asset, anywhere from mailings. We do a lot of mailings monthly. They help at the front desk when visitors come in at the pop-in residence, or even at the front desk at our downtown main office. They help with filing. There's so much filing for all these patient files that need to be done. So that helps our team, our staff, do other jobs that are very, very important that need to be done first.
Direct with patients.
Right. So everything that they do is it's just an asset. And patient care. They'll do follow-up calls when a bereavement, one of our grief counselors talks to the family. It's been a period of time. Do they need more counseling? So that's very important that we get that word out. Say, hey, do you still need some counseling? We have it available for you. It's not, a week or a year after.
Because sometimes that grief will just pop up from nowhere and you don't expect it, and it can be 2 years later.
Yeah, and you need that extra support. Well, we're there for that extra support to help you whenever you need it, be it, a close family member or a close family member that has been part of your extended family. We're there to support that. We also have part of the bereavement group. We have adult, and then we have a children's section too. So it's for all ages that we have private counseling, group counseling, and then semi-private group counseling. We also have Camp Courage for ages 6 to 15. That's a 3-day summer camp where they have special programs for these kids to help them through this process, not only to have fun, because they do a lot of fun things, but also maybe some one-on-one counseling to help maybe bring out some of these feelings that maybe they've been hiding, they're afraid to talk about. So it's really important that, we have those volunteers to help. Another thing with patient care, we have music therapy. There's a lot of patients that soothes them to have music therapy, be it listening to music. We have some beautiful singers that work for us that can sing.
And the volunteers.
And the volunteers. So we have a nice variety that can help these patients. We have, again, our veterans with the pinnings, and then they can have vet-to-vet conversations. We have massage therapists. We have people that have extra training that can come and do hand and foot massages. Cosmetology, we have volunteers that come and are certified cosmetologists that can cut hair, manicures, pedicures, just something to make the patient feel special.
Oh, nice.
So
Really
we have
big variety of jobs. So you don't have to have just, you're not dealing just with patients or whatever. There's a big variety of things. And I imagine they go through some kind of training for most of those things. Because even if they're cutting hair, you still have to know how to talk to somebody.
Right.
And some of those
Absolutely.
things.
They do have an initial phone screening, and then there's a 6-hour day-long training that Paula, our volunteer coordinator, does a wonderful job at. And if there's additional trainings that are needed, then some of the volunteers will go through some additional training.
Okay. And how do they, if they're interested, somebody's interested in that, do they call the main number of Harbor Hospice?
They can call the main number.
Okay. And let's give that number.
It's 231-728-3442.
Excellent. I do have that number memorized. We only have a few minutes left, but I was going to talk about advanced directives, unless there's something else that you want to talk about more. Do you feel like?
No, that's
So, I mean, because I think it's so tied together. So Lisa
It
and I
is.
serve with a really great group of people on something that I think I've talked about before called the Chartered Healthcare Planning Coalition. And our mission is to promote advanced directives, which are a piece that basically you should do anytime after the age of 18. You do not have to
Truly,
be dying
yes.
for that. We all need to have them. And it's to let your loved ones in the medical profession know how you want things to be done, because none of us ever know when something could happen. And strokes happen, and accidents happen, and cancer diagnoses happen. And you want to, and it's a way that allows people to do all kinds of things, not just do not resuscitates, but
Right.
whether you want that music, whether you want to have a funeral, you want cremation, burial, all kinds of information.
Mm-hmm.
So what do you think? So you're more newly involved, but you've jumped in,
Yes.
all hands and feet and everything, I think, into this.
Well, and I did have some involvement in Grand Rapids as well with
Which is
that
great
with
for
that
us.
program, yes. And you know, I really encourage people about advanced directives because there's so many things in life that are unexpected. We just don't know what could happen today, 5 minutes from now,
Right.
tomorrow. And it's important for people to know what your wishes are. And that so ties in with hospice as we are trying, you know, very hard to meet their needs, what they want, what do you consider quality of life, what is it that you would like to happen, you know, and whether it's hospice or just, like you said, at 18 years old, anything could happen. And wouldn't you want to know, wouldn't you want your healthcare providers to know what kind of treatments you wanted? And sometimes, unfortunately, we get in positions where maybe you can't even communicate that. And doesn't mean there aren't things that can be done, and you want that in writing. You want to be able to be your own voice.
Right.
You know, and oftentimes, because people don't do advance directives, that is a burden that gets put on the family.
And that's a huge burden.
Yeah.
Because you're trying to guess, do I think mom or dad or my loved one would want this or this? And with the holidays coming up, it's an uncomfortable
Yeah.
discussion to have, but it's probably,
is.
a lot of times the holiday time is when we are together. So you probably don't want to do that on Christmas Day.
Right.
But if you're around each other for a while, it is, you know, it is a good time to have that conversation, don't you think?
Oh, I absolutely think so. And, you know, even talking to people that I'm close with and my family and friends, people are afraid to talk about death and dying. And it's not really what that conversation is about, though. It's about if something were to happen to me, that my wishes, my desires are fulfilled.
Right.
And fulfilled the way I wanted that done, or how you wanted that
It truly
done.
is a gift for your family
It
to
is
have,
a-
to have provided that information to somebody.
It
So they're not
truly is.
figuring it out because there's enough stress when you're dealing with a hospitalization or something, especially when they're
Absolutely.
unexpected. And you're having to figure out what is this doctor telling me? What does all of this mean? So,
Yeah,
so
definitely.
if you haven't done that, there is a charted website. You can just Google or check or look on some of our websites for charted Muskegon. I can't remember the website right offhand. I think it's just charted.org possibly. And look and all the documents are on there. So we are running out of time. So boy, that went fast.
It surely did.
We always think it's going to be scary.
Yeah.
I want to thank you, Lisa and Lori, for coming and joining us, giving our viewers lots of good information. Let's remember to call Harbor Hospice if you want more information at their main number, 231-728-3442. If you can't remember that, you can always call the Community Access Line of the Lakeshore. Call 211-211, and they will be happy to connect you with Harbor Hospice. Any last words for the last 10 seconds?
Well, we do also have our website,
Okay.
which is harborhospicemi.org. That's harborhospicemi.org. So you can certainly obtain information that way as well.
Perfect. Thank you for joining us. We hope you'll come back next month.
Thank
Well,
you.
thank you.
Thanks so much.
Yeah.